registered physiotherapist. Today I'd like to talk to you about the relationship, in my experience in the clinic, the relationship between posture and just the different positions and how they influence, from a biomechanical perspective, both the shoulder and the hip, which are both, they're called ball and socket joints. So there's so many conditions I can think of in both of these areas, right? So again, the hip and the shoulder, that are influenced by the positions we're in on a regular basis. I see this so often, for example, with let's say office workers. So for the shoulder, for example, one of the most common sort of conditions that I'll treat for individuals, particularly people who sit at the desk for long periods of time, and kind of your classic weekend warrior, where they'll be sitting sort of all week long in this sort of slumped position like that, and then perhaps on the weekends they play some kind of recreational, I don't know, volleyball, softball, some kind of overhead sport. And what will happen is, in a lot of cases, these individuals are prone to what's referred to as an impingement syndrome in the shoulder. So essentially what this impingement syndrome is there'll be a position, typically around 90 degrees of abduction is called, where either a bursa or a lot of times there's a rotator cuff tendon that gets irritated when we go into this repetitive abduction position as a result of this rounded shoulder position. So again, as a result of sitting like this all day, poor posture, and sort of a compression, so to speak, of the shoulder, when they then go do this overhead activity, this bursa, this tendon gets irritated and then eventually becomes inflamed. And so I see it again in shoulders. I see it sometimes with, again, rotator cuff injuries of some type, same sort of idea, where it gets irritated because of being in this sort of position. And so one of my favorite things to give in terms of an exercise is essentially opening up that capsule, particularly the anterior capsule. And one of my favorite exercises is this extension, repeated extensions, right? Going back, so a lot of times I'll actually have somebody use a cane, repeated extensions, repeated extensions. And so what this really does, again, is it opens up, loosens up the anterior capsule and repositions that shoulder in more of an open position. So essentially it's doing the opposite, right, of that particular posture. Exact same idea happens in a lot of cases with the hip. Again, anterior portion of the hip, if we're sitting for a long period of time, several conditions will come about as a result of this. You'll find hip bursitis along the side here, hip impingement, where the psoas muscle or the labrum in a lot of ways will get irritated and pinched and aggravated. You're super tight in through here, and a lot of cases with the hip, and also quite frankly with the shoulder, tightness in the anterior portion of the hip, weakness in the glutes. And it's very common. I see this so often in the clinic, where when the patient is again continuously going into, let's say, flex type positions or positions in which you're closing down, so to speak, this front portion of the hip, it irritates it. So similar in a lot of cases to what we'll do with the shoulder, hip openers, right? Psoas stretch, hip flexor stretch, IT band stretch, and quad. So a lot of times what we're dealing with, they present, again, because it's a ball and socket joint, in a lot of cases, a lot of these symptoms present very similarly in terms of what we're looking at from a shoulder and hip perspective, and also how it relates to the positions we're in on a regular basis. It's things I talk about all the time when I see patients. Is we have to bias, in a lot of ways, we have to bias the opposite of what we're doing all day, because in a lot of cases it hinders the body in a lot of different ways. So in my experience, balance, the body works best with balance, right? So if I'm sitting all day long like this, if I'm in this sort of hip flexion position all day long, well, what's going to happen? All these muscles in through the front, all these muscles in through the anterior portion of the hip, they're going to get tighter. What's going to result of that? Different biomechanical issues which will impede activity level. How do we correct it? We've got to open the body up, right? We've got to stretch out the anterior capsule of both the front portion of the shoulder as well as the hip. Please make sure to leave a comment below, and also make sure that any of the exercises I give are, again, recommended by a registered physiotherapist for you, and that they're appropriate for your condition. Thanks as always for watching. Have a great day.